last thing that's very important for folks to understand is that if you are considered fully vaccinated, you must be symptomatic. They do not accept samples for anyone who is deemed asymptomatic or non-symptomatic. So there's completely different rules for fully vaccinated and what they are calling unvaccinated, which includes the partially vaccinated. The unvaccinated and partially vaccinated are grouped together. So far, does that make sense, everybody? And I think we're
Yep.
all intelligent enough to see why they're doing that and how ridiculously that compromises the integrity of the data. Okay. So with that being said, can I share, I can share a screen real quick, Charles. I won't take up everybody's time. I know you have a lot of speakers today,
Real
but
quick.
I'll do this for you and show you the data, and then I will send this to everybody on the list, Charles, with your permission. I'll send them this PDF of this, if that's okay with you.
Yep.
Okay. So we looked at all 50 state health departments. We have references in here in column E. We also have notes on references in column F. Okay. So you can verify everything that we've found here. We found that only 31 out of 51 US health departments, 51 including Washington, D.C., are actually reporting any data on vaccine breakthrough. That means 20 state health departments aren't revealing anything. This totals came when we looked this up. This is through November 14th, and we'll update this once a month now. In terms of breakthrough cases, there are a confirmed 1,446,807 breakthrough cases, AKA times that this experimental device has failed to protect. Breakthrough hospitalizations, 56,324. Keep in mind, that's only in what are deemed the fully vaccinated, okay? If we had a category for partially vaccinated, that would be even higher. It'd be much, much higher. And then breakthrough deaths, sadly, there have been 16,111. By comparison, on and around the same time frame, the CDC was saying that there was only 10,857 breakthrough deaths, 30,000 breakthrough hospitalizations. So the CDC was dramatically underreporting this. And this number here, breakthrough cases, the CDC stopped reporting on April 30th of this year. So the CDC has known that there are major problems with vaccine failure and are misleading the American people yet again. And to get the real information, you have to go down to the state health departments and do the work and put it together. So that's what we did.
Thank you very much, Dr. H. And if folks could mute themselves, we all should know by now in the Zoom world that, that we can't afford background noise. Alex, has Nurse Bridges arrived? I can't hear you. You're muted, Alex.
She hasn't yet, and I've been working behind the scenes because
no problem. We can come back. And folks, write down your questions and look for the raise hand icon under the tab reactions, so we could get through the meat of the presentations and have more fun in the Q&A. Dr. Ace, let's let folks digest that a bit.
Sure.
Thank you for bringing some legitimate backing to the signals we've all been seeing for months now, that this is a crisis for the vaccinated. And we'll come back to you before we move on to a different topic, of course.
Charles, a last thought on that.
Yeah, go ahead.
I think the talking point for all of us doing interviews and everything is that, and I've talked with a number of presenters about this, we should be terming this as a pandemic of the unhealthy. And really, because we have massive amounts of data to substantiate that. And I think it really frames what is actually going on. It's a pandemic of the unhealthy, the people with multiple comorbidities. It's really simple.
Yeah, that makes sense. Thanks, Dr. H. And we'll come back to you in a second. So because of the danger of the experiment, leaders are stepping forth in a lot of industries to push back against the mandates coming from governments and employers. And we have two of those leaders right now, Professor Adicott and Ms. O'Brien, defending respectively soldiers and pilots. And in Kate's case, not just pilots, but also other transport workers. Professor Adicott, you're driving, so I'll let you go first in case you need to hang it to be safe. So As Greg Glazer will present after you, we have a bill with Congressman Gomert in Congress to establish an exemption from all shots, because the best studies that those who are paying attention are showing the real epidemic, chronic disease, stems from over-vaccination. And that's an issue for readiness. Soldiers, leadership in Pentagon are saying, we're not getting quality applicants to be soldiers. And the chronic disease epidemic affecting over half the country now is being caused, as a series of studies recently show, from the over-vaccination that Greg will get into, that justifies our bill. Nevertheless, Professor Adicott, let me tell us about the pushback from soldiers. How adamant are our brave soldiers about not being interested in participating in this risky experiment? And what are you doing about it? Do you want to unmute yourself, Professor Adicott? If you're still there, and we can come back to you as you figure that out.
I'm still here. Can you all hear me now?
Yeah, go ahead, Jeff.
Okay, good. Yeah, sorry about that. I run the Warrior Defense Project. I'm a law professor. I did 20 years in the United States Army as a JAG officer. I was the senior legal advisor to the U.S. Army Special Forces, worked in the Pentagon. And so for the last 20 years, I've been doing pro bono, which means no money to us, legal representation for soldiers. And I have, dozens of cases of individuals that have reached out to me on the vaccine issue. So the bottom line is the Biden administration has ordered that all military personnel must be vaccinated. But there are two exemptions. We have exemptions for religious reasons and for medical reasons. But there's a huge catch-22, because even if you get the exemption, which is very difficult to obtain, they can declare that you're now non-deployable, and therefore they can administratively separate you from the military. And so that's, many of these soldiers that I represent, some of them have 17, 18 years in service. If they don't take the shot and if they don't get the exemption, then they're going to be pushed out of the military, receive no pay and benefits. For example, I have a client that 18 years in service, got a family and kids, and he's decided, I'm just going to have to take the shot because I can't give up. I'm so close to retirement. But we've got anecdotal evidence, that I haven't conducted any studies of soldiers that have taken the shot and have extremely adverse reactions to the shot. But again, from my perspective, it's really a bad news situation for the military because, as I said, even if you get the exemption, which is difficult to get, there's that catch-22. If they want to declare you as non-deployable, which means that you cannot be sent overseas, then they could administratively separate you from the military. And initially there was talk to give you an other than honorable discharge, but we've had pushback on that. So now what the discharge will be is an honorable discharge, but you will get, if you haven't reached the 20-year mark, you're forfeiting all your retirement benefits. So it's a nightmare.
Professor Adicott, talk about the readiness issue. Isn't that something the military already is struggling with for soldier recruitment? Jeff, are you there?
Yeah. Yes, I am. We broke up a little. Yeah, the readiness. The morale is extremely low. The morale's already low with this administration for a variety of reasons, from Afghanistan to diversity training and CRT training in the military. It's destroying the morale, the esprit de corps of the military, and that's something that we cannot afford. This is really an unnecessary step, in my opinion. The Biden administration is forcing on people, but their talking point is, well, we give soldiers in the military all sorts of shots anyway. This is just another shot. But they fail to take into account, the fact that this is really an experimental drug. And while it was not approved by the FDA, quote unquote, they couldn't push forward with the mandate. But now they're going full steam ahead. And unless we can get some congressional pushback from leaders like Congressman Gomert.
You faded, Jeff. Are you still there? So when Jeff comes back, we'll let him talk about what he's doing about it with the lawsuit. Jeff, I assume you're not there. And Kate, the same thing is happening with the pilots. I just saw an article that up to 40% of truckers aren't going to join this experiment, and that's going to exacerbate our supply chain crisis. And you're more focused, I guess, on pilots, Kate. So tell me about what the pilots are up to.
So, yes, we are a grassroots movement organization that was started by pilots, but we have grown to encompass all transportation professionals. So, and just a brief note on the truckers, it wasn't just no in the survey, it was hell no, I'm not taking the shot. So that would be completely catastrophic for our supply chain if 37% of truckers were not able to drive on the road. And quoting the American Trucker Association president, he said that even if it was just 3.7%, it would be a total failure of the supply chain. So we're focusing as a group also to shift the paradigm for people away from this. For example, at American Airlines, it's about 40% of the entire workforce. So that's pilots, that's ground crew, that's mechanics, that's flight attendants, gate agents, that's everybody. And so the mentality is, well, it's only 40% of us, we're not the majority. So our work is really trying to refocus people into seeing that 40% is a significant portion of a workforce. Yes, it's not a majority of people, but you can't run businesses. You can't hire people to work at McDonald's right now for $18 an hour. They're not going to be able to restaff an airline from soup to nuts, from bottom to top. So really, we're trying to empower people to understand that they are powerful, they themselves, but when we stand together, we're an unstoppable force. So what we're doing, we started as a group that was pushing back on any attempts to undermine medical freedom. And that quickly turned into us actively pushing back against these mandates. We are filing in the Middle District of Florida imminently, I'm told today, on behalf of federal contractors, which would include airline employees. And so we've decided that we're taking a stand. This is the hill that we are dying on as transportation professionals. So we also want to get the message out to passengers that we're standing today, because it's transportation professionals today, it's passengers tomorrow. It's you have to get this vaccine to keep your job today. It's you have to undergo another medical procedure to get access to your bank account tomorrow. And in that vein, and I'm glad that people are talking about legislation, our main talking point also for passengers is to highlight the fact that there's a bill in the House right now. It's HR 4980. It was brought by Richie Torres from New York, which says that any passenger would not be able to take off or land on an airstrip or airport in the United States or its territories unless you are fully vaccinated for COVID-19. I wish I was making that up. I wish I was being hyperbolic, but I'm not. So you're in the process of growing again to encourage passengers to join us. We have started an international and national coalition. We've teamed up with other freedom movements. New Yorkers Against Medical Mandates in New York State is one of them. They've been a really solid group of people that are motivated, and they're working to push back. But we also have international alliances with other transportation groups in Europe, Canada, and Australia that are doing the same thing that we are doing. So we exist to educate and inform people of their bodily sovereignty, their medical autonomy, and most importantly, that these rights are given to us by God, and that no government can and or should infringe on those rights.
Outstanding. And in the chat, can you list your organization link and tell us also now what your organization is?
Sure. Sorry, maybe I should say that. We're the U.S. Freedom Flyers. And so I'll put our website on there, but we're usfreedomflyers.org. And like I said, we started out small, and now we are approaching the 100,000 member mark. So we're very, very excited. We are hopeful at what we've been seeing in the Fifth Circuit with regard to OSHA. And we're confident that once we bring our suit today against the federal contract portion, we're confident that we're going to strike that down as well. And just a side note, we're working with George Wentz from Davalier Law Group, who is, I'm told, I didn't know this, Reiner Fulmick, he's Reiner Fulmick's mentor. So I'm happy to hear about that. He's a constitutional lawyer. He's a really great guy, and he's got good vision and good strategy. So we're very, very hopeful that we're going to get some traction with.
Yeah, I've got some questions written down when we start to raise our hands and ask questions. And I think this is a great panel of speakers to bring it all home. And you can see how comprehensive this movement has become for health freedom. And speaking of lawyers, Greg, I guess, Kate mentioned Congressman Torres's bill to, prohibit flying for those too smart and healthy to want to join this extremely dangerous experiment. And we have a bill through Congressman Gomer, just to make it simple. If there's federal funding involved, you can exercise a national exemption, which we call the National Informed Consent Exemption, not just from the COVID shot, but from any shot, because we're going to have future shots. Does anyone not think this control effort is not going to continue and get worse in some other aspect? So it's not just gumming up the COVID shot mandates. It's about going on offense and also trying to fix science, because vaccine science is corrupt, as Greg can explain. And Greg, why don't you kind of show your site around the bill and tell us about the organizations getting behind, and we'll hear from Dr. Singleton on why one of the most eminent doctor organizations going back to World War II time has decided to endorse it as probably the bill that we can all coalesce around to regain informed consent. Greg, if you want to comment.
Thank you so much, Charles. Yes. So I have been very encouraged by the tremendous support that we are receiving from groups who support NICE, Congressman Gomert's bill. And the reason that the bill is gaining such excellent support is because it is a common sense solution that will protect everyone. The bill, what it does is it prevents vaccine mandates nationwide for the whole schedule, not just COVID-19. Obviously, there are 250 vaccines in research and development, according to the trade publication Pharma. There will come a time when people want to decline a vaccine. In fact, that's already here. Whether it's a COVID booster or a flu shot, or there's so many different vaccines. And so this is what people are getting behind. Even people who are pro-vaccine are getting behind the idea of informed consent. And that is why doctors' organizations in particular are so strong here, because the doctors know that informed consent is essential. This is a fundamental right. It's a constitutional issue. And the doctors are standing up, not just for our constitutional rights, but also for good science. What does good science look like? Well, first and foremost, it looks like control groups, legitimate control groups, where we compare a group of people who received the product in question to a group that did not. And when we look back historically, this was a successful approach to change an entire industry. For example, look at tobacco. We knew and we proved that cigarettes were dangerous. The ingredients in cigarettes were dangerous. But you know what it took to really show that cigarettes cause lung cancer? It took a control group, people who don't smoke. And you look at their rates of lung cancer and you compare them to people who do smoke. It's so simple. And it's the same thing that you find with other products as well. And with vaccination, however, the FDA and the manufacturer will compare a group of individuals who receive lots of vaccines to a group that also receives lots of vaccines. And if the injury rates are the same, they say vaccines don't cause injury. This, of course, is ridiculous, but it's the current state of science. So that needs to be fixed with fully unvaccinated control groups. That brings me back to the NICE Act, Congressman Gomert's bill. We provide a provision in the NICE Act that encourages the study of fully unvaccinated control groups quickly within the next 4 years. And that's very important because we need to address this. We need to fill this gap in the science. We need to address it in a intelligent way. Because so far, all of the emerging research, including a study that my group conducted, it shows that the fully unvaccinated are not just a little bit healthier. They're exponentially healthier, magnitudes healthier. Our group found over 1,000%, over 10 times healthier. In some categories, it's far larger than that, 50,000%. Just ridiculous numbers that just show vaccines are causing this chronic illness epidemic. So that's our new data. But what about old data? What about old government data? What does that show? It shows that when at the turn of the century in 1900, we had a lot of serious problems, a lot of serious health problems. And some of those were infectious diseases. Things like pneumonia was top of the list for things that caused death in the year 1900. Tuberculosis, diarrhea, and enteritis. And then heart disease was under there. But then when you get to the modern era, it flips. So now infectious diseases are a very small problem, and chronic diseases are the main problem. Heart disease, cancer, stroke, lung disease. These are now the main killers of people. So what happened? How did we trade infectious disease for chronic illness? And was there ever a time in the middle, a sweet spot, where we actually had solved the problem? The answer is yes, there was a sweet spot. It was in the 1950s, pretty much. In the 1950s, engineers and others had solved the infectious disease problem. It was not vaccines. Vaccines took the credit, but it was really engineering. It was better plumbing, access to year-round food at the supermarket. It was better sanitation, just like simple stuff. People washing their clothes regularly. A lot of appliance stuff was very, very helpful. And so, and also reduced crowding in cities was a huge factor as well, which really goes to engineers and contractors. So anyway, the point I'm making is that science did solve a lot of these problems by 1950. And in the 1950s, the average uptake for vaccines was about 3 vaccines total. That's about what people would get, about 3. Compared to today, the answer is 72, if you count the dosage. So what you have is, in the 1950s, we solved the problem, pretty much. It was the sweetest spot we've ever discovered as people. And then it got worse in the 1960s and 70s and 80s, then it keeps getting worse. What happened in the 1960s? What happened? The National Vaccine Program was signed into law, and vaccines all across the country were funded, and all you see is the trajectory going up and up. Every year getting more and more vaccines. And then whenever there's a spike in the number of vaccines, such as in the 1980s and the early 2000s, you also get a spike in the chronic illness rate. Can this be calculated? Yes, it can. We did this with what's called the Pearson correlation coefficient. What you do is you compare the rate of increase in chronic illness to the rate of increase in the vaccine schedule. It's just 2 ratios that you compare. And what we found is that the correlation is a 0.99% match. That is a near perfect correlation. So reasonable individuals would say that really looks like causation. So to prove causation, that's where the control group comes in. It's the definitive way to solve this issue. So in conclusion, what the NICE Act does is it protects all individuals and gives individuals choice. That's the first step. It's like putting out the fire in the kitchen. And then what it also does is it encourages these fully unvaccinated studies in the future, the near future, so that we can finally fix the whole house and fix this country.
And because Greg, and for everyone who doesn't know, Greg is known as the human vaccine encyclopedia among the vaccine informed consent choice lawyers in the country, involved in a lot of cases. Thank you, Greg. Because it puts out the fire with the easy exemption just to decline all the shots. And it prohibits the government from refusing to study the unvaccinated so we can have control group science to study what is causing the chronic disease epidemic, which is the real epidemic in this country. lots of organizations, dozens, have endorsed the NICE Act, including the Venerable Association of American Physicians and Surgeons, AAPS, which Dr. Singleton started in the 40s. So tell us why the AAPS is still around, making great events, good policy decisions, good issues, and why did you get behind this bill?
Hello, nice to be here. And just to correct Charles's grammar, I didn't start it in 1943. So,
Oops.
oh, hopefully it wasn't me. But I want to piggyback on something first that Dr. Ely said, and it was a headline that was in the patch. I don't know how many of you get the
Broccoli,
patch. Kind of
asparagus, cucumbers, carrots, and
One second, Dr. Benz, if you could mute yourself, and everyone else, the mute button is there for a reason. Thank you. Go ahead, Dr. Singleton.
That was this big headline, and I'll read it to you. Alert: mystery emergency among COVID-19 patterns in LA County. What's the mystery? During the 2-week period ending November 6th, several of the Los Angeles County communities with the highest rates of coronavirus cases are also the communities that have the highest vaccination rates. And it's so amusing because this is the big alert and the big mystery. And of course, what their answer is do more vaccinations. It's like they don't want to make the correlation. And it's something that Greg just talked about, that the people are unhealthy. And they'll even say this later on in the article. People in those communities may also have lower levels of natural immunity due to low levels of coronavirus exposure. It's reminiscent of polio that they called the rich man's disease, because poor people weren't getting it because they had had constant exposure, low level, to various respiratory viruses, including the polio virus. Anyway, so an aside, but it's fascinating how they come up with the answer, kind of the wrong answer. The information is right in front of them. And like what Greg said, then they come up with the wrong answer. So there's no question that Congressman Gomert's legislation is needed. AAPS years ago had made a statement on informed consent. And we certainly put it out there as, this is not to say whether we're going to be pro-vaccination or anti-vaccination. We're pro-Hippocratic Oath medicine, which means you do everything to benefit the patient. And looking at informed consent is a way to benefit a patient. We give informed consent for anything we do to patients, and vaccinations are certainly no less than other minor procedures. And I think this COVID vaccination certainly has brought out the issue, because there are so many negative effects that in fact it's a bigger deal than some other, excuse me, than some other procedures that have this panoply of paperwork for informed consent. And this is a good way to address the problem without having to say, I hate vaccinations or I love vaccinations. It's our right as patients, our duty as physicians to have informed consent. And that's why AAPS is strongly behind it. So thank you.
Thank you, Dr. Singleton. You are a force of nature for health reform, and AAPS has put on such great events for all these decades. It's interesting that your organization goes back about a decade earlier. 1943, I think, is when it founded, and NHF was founded in 1955. So I might imagine that folks in both organizations have cooperated here and there way back when both organizations were trying to support the top doctors and other healers who were offering sometimes therapies that the powers that be didn't like. So that's definitely, NHF's history. And Dr. Benz, out of the COVID hysteria and something AAPS has been involved with, a lot of people want to reform the system. not just regain our informed consent, but really reform the system in many ways. And before you start, does anybody want to sneak in a quick question of our speakers thus far, Professor Adicott, Ms. O'Brien, Dr. Ely, or Greg, or Dr. Singleton? If so, just click the raise hand icon. Otherwise, just write down your question, and we'll wait till the last two speakers kind of get their piece across. Dr. Benz, I think you have a slide to show, and you want to talk about our health upgrade project. You want to unmute yourself, Charles? Dr. Benz, you need to unmute yourself. While he figures that, has Scott arrived, Alex?
He hasn't yet. No, I've called him and I've called Jennifer.
That's okay. You know, we're here the third Friday of every month. So in December 17th at noon, we can update you on Codex. It's not like Codex ever ends. You know, that's a gift that keeps on giving. Dr. Benz, there, you're unmuted. Go ahead.
Okay, thanks, Charlie. Sorry, I had to go and get a garage door guy to get paid. So this is the next step in our 6-step process. The first step was to name the problem. The second step was to name the goal. The third step was to do some root cause analysis to see what the root cause of the problem is. And then this step coming up is the creative brainstorming section. And so what we're asking everybody to do is look at the list of root cause problems that were created. And I think that Charlie has that list and can attach that to anything that goes out today as part of this process. And the goal here is to find solutions that are low in effort but high in impact. And effort in this case might include political resistance, social resistance, too much cost involved or too much time involved. So we want to get those that are able to meet that criteria generally. And then the other criteria is for impact, including something that affects a lot of people in a significant way. It can also help to reduce cost, improve health, and reduce red tape or regulations. Example might be promote the use of the Golden Carrot Award through parent teachers associations to evaluate the quality of the school lunch program. So what we're doing is we're taking an existing program that's been very successful in school districts across the country and just saying, look, all you parent teachers associations, you need to put pressure on your school boards to really find out what the quality of your school lunch program is. And once you get that evaluation, then you'll have a sort of a roadmap to try to find ways to improve it. So this has been done, but we need to do this throughout the country. In other words, we shouldn't continue to be putting these kids in a school lunch program that's feeding them products that are surplus and not good surplus products. And so any school district that does this evaluation has multiple things that can be done to improve it. So that's just one idea, but it gives you an idea of something that can be done easily with every school district across the country. And all we need to do is get some communication going with them. And it doesn't cost a lot of money to do this, an existing program. So we're trying to capitalize on the best practices that are already there. So I just wanted to give that example because that's the kind of best practice examples. We're looking for all the categories that are in the list of the root causes.
And just to remind or educate folks who don't know what Dr. Benz is talking about, this past August, one of the dynamics that happens with the health advocates is the question, when are we going to go on offense? So the COVID hysteria woke up half the country that our special interests have captured our bureaucracies. Those of us in healthcare knew before then that there was a cartel all oligopolizing the market. So this past August, we started a health upgrade project, and in chat is a link where if you want to roll up your sleeves and join our recurring meetings to prioritize the submitted problems and go and run them through that matrix between how much effort is there to enact that change versus how impactful that change would be. Just click that link and list the 3 biggest problems you think are in the healthcare system. And by doing that, you'll be invited. This isn't a observatory effort. You just can't sit in a Zoom and watch. This is for those who want to lead. So please, if you are ready to get busy and help us do this work, we'll have breakout sessions in the Zoom, for example. Just fill in your 3 problems and you'll be invited to the next meeting, December 10th. We've had several meetings. So with that, we can open up to Q&A. If you want to look at the reactions tab around your Zoom controls, you'll see the raise hand icon. We're trying to triage the biggest risk, people losing their jobs for not vaccinating. We want to go on offense to upgrade the whole system in a myriad ways. So we've had lots of good speakers. And, Alex, I could start off the questions if you like. First, is Professor Adicott back on the line, or did he have to get on the road and drive away? If you want to unmute yourself, let me know you're here. I want to ask a bit more about what you're doing for the soldiers. And if anyone sees Professor Adicott, just chat to him that we're looking forward to hearing from him. Dr. H, Dr. Ely, what can folks do with this data that you've uncovered from the state public health departments that increasingly it's going to be harder for the special interest to hide that vaccination is sending folks to the hospital? We do have, as you say, a pandemic of the unhealthy. How important is this data that you're uncovering to help these people trying to keep their jobs and not join the experiment?
I wish I could answer that, Charles. I think it's another log on this, Mount Olympus of fire that we have. And I really think that it's going to be useful for the attorneys more than anything else. I think it's going to be useful for people who have active cases. When I read through Judge Englehart's opinion in the Fifth Circuit ruling last week, and if you haven't read it, you owe it to yourself to read that opinion. It was one of the most scathing opinions I've ever read in my life, and it'll put a smile on your face. I think what it told me was that the legal teams did a great job of educating the judge. And I think it's going to be data like this that presents an educational opportunity for the judges. So the ones that are captured won't be able to pretend they didn't know it. And the ones that aren't captured and have been doing their own research will feel substantiated by it. So I think it's important that our legal teams present themselves as educators in these situations. And I think data like this gives them the opportunity to do so.
And Greg and Alex, if someone raises their hand, let me know. Do you agree, Greg, with Dr. H's assessment of that Fifth Circuit stay on Biden's OSHA mandate, which OSHA itself has decided not to enforce? Despite that, Biden still wants employers to mandate. How do you see? Go ahead, Greg.
Yeah. So the Fifth Circuit decision was helpful, and what the court did is it respected individual rights, respected civil liberties, and ultimately overruled the mandate. And it's currently being debated whether the decision applies only in the Fifth Circuit, like Texas and Louisiana, or whether it also applies nationwide. That will be resolved shortly, probably in the Sixth Circuit decision, which will be coming up next. And the Biden administration will be asking the Sixth Circuit to opine on the Fifth Circuit decision. So I'm, like others in the movement, I'm definitely pleased about the Fifth Circuit outcome. I would say that I do have some criticisms of the decision when I read the fine print. And my position would be that some of it is dicta, meaning non-binding. But unfortunately, the Fifth Circuit decision did look at the case of Jacobson versus Massachusetts and say that this is a states' rights issue. So it's kind of like two different government authorities fighting over who gets to hold the needle that injects us. Whereas I would have liked to see a stronger statement by the Fifth Circuit that said that this OSHA mandate is not just overbroad because of federalism, but it's also overbroad because of individual constitutional rights. And so part of the good news here is that there are 3 state attorney generals that are really taking the lead to bring exactly that case, to challenge Jacobson versus Massachusetts, to uphold our right to decline this vaccine on individual grounds, not just at the federal level, but the state level as well. Those 3 attorney generals are from Arizona, Mr. Brnovich, and Texas, Paxton, as well as Oklahoma. So those are the 3 cases in particular that I'm watching very closely, and I'd be happy to do a newsletter through NHF once we have a good update on it. And thank you, Dr. Healy. I agree.
And Greg, if you could just quickly comment also on Professor Adicott and Ms. O'Brien, their efforts to defend soldiers and pilots and other transport workers, and maybe even Nurse Bridges defending nurses to keep their jobs. How do you feel about those individual market lawsuits?
I think they're so important. You know, those cases are going to be trend setting. They're going to be leading. The precedential value is very high, especially because the standards in the military and standards for essential workers we generally hold these individuals to a higher standard there because they're so important. And so I think that also emphasizes how seriously judges take the cases because it affects infrastructure. And each case has great counsel. I'm very pleased about that. Seeing just really big law firms. We talked about George Wentz's law firm earlier on the call today. That's a really top law firm. So what we're seeing is the cavalry has arrived. You know, for years we've been litigating these vaccine cases, and they were intended to be some of the smaller law firms, kind of niche. Every now and then you'd get a big one, but now it is completely different. In 2021, some of the biggest law firms across the country have joined this. Not just that, the attorneys general have joined this movement to challenge vaccine mandates. That has never happened. That means the cavalry has arrived. So I'm very pleased.
Great. Alex, you want to take care of the hands up?
Yeah, we have Jack and Dr. Ben. So whoever would like to go first. Dr. Benz?
All right. I think the whole idea of educating the judges is brilliant. And I think that there's a lot that could be added to that educational opportunity. One of the things that we should tell these judges is that we've been treating these viruses successfully for about 30 years. And there's over 5,000 scientific studies to show that these treatments work. And these are the same treatments that work for COVID. So to try to make a difference between these viruses is absurd. And so they've been trying to say if it's not a study that was done with COVID, then it doesn't work. This is absolutely untrue. There's no evidence to support that. And the other thing is that now we're finding out that a lot of people who have pre-existing conditions like AFib, if they get the vaccination, they're at risk, serious risk of a negative reaction. Those people would be so much better off with these natural preventative and treatment studies that we know about compared to the vaccinations, that this is another piece of science that needs to go into the education of these judges. So this gives them a couple of practical things to base their judgment on, just not the legal status of the right of choice. Now you're giving them actual evidence, scientific evidence that there's a better way to do this, and that covers a lot more people than might be covered otherwise. So that's my suggestion.
Can I piggyback on that real quick, Charles? The natural side of things too. So Yeah, and with that, I totally agree with you, Dr. Benz, on that. And that's why we've put together, in March, we put together a peer-reviewed study with executive summaries for judges and for attorneys for these situations, because we've collected, and we're not the only team out there doing it, because I love what C19 Early is doing. They're just doing such a phenomenal job of data collection and analysis. But it's very clear everything you're saying, and we're even getting more and more reports coming out in terms of, we just got a report dropped today on curcuma and its incredible effectiveness. And these were some of the natural herbals that we've suspected were going to have efficacy against the SARS-CoV-2 virus, but garlic, turmeric, all the regular stuff we've always used for decades for virals, astragalus root, everything works just as fine on this man-made crap as well. So it's the same, because it's all based upon the same mechanisms of action. And I think when we're talking with judges, it's not about using the name garlic or something, because then you tie into preconceived ideas of people's idea about, oh, voodoo and witchcraft and all this other crap. It's getting down to the science of, this is the mechanism of action. And that's something that I think Dr. Zelenko has done an excellent job of in showing how zinc plays an instrumental role at preventing viral replication in the cell. We have to be able to explain this at a mechanism of action level. And that's what my team has been doing, I think, a really good job of on this. But thank you, Dr. Benz, for saying what you said. I agree with you 100%.
Yes. If you ever need any help in that area, that's all I've been doing for 2 years, is looking at the mechanisms of action of each of these supplements.
Mm-hmm.
And there's a new study out just a couple of days ago on all the vitamin Bs have now been classified as anti-COVID-19. And so there's now.
Wait, what did you just tell me? What?
Yes.
Repeat that.
Yeah.
You just said see, now this is very interesting, Charles, because the B vitamins play the instrumental role in the mitochondrial energy production, ATP, and adenosine 5' triphosphate energy production mechanism action. And it's exactly the spike protein that breaks down and decouples the electron transport chain in the mitochondria. So that is phenomenal. And I suspected that was, we have to talk. So I'm gonna put my number in the chat for everybody who needs it. But
no worries.
Let me send it over. We gotta talk.
Okay, good.
I just think how the dynamic role antioxidants has played in saving human lives, dealing with this particular pandemic, and how a healthy immune system response is better than any vaccine anywhere. Okay. Greg, this is a room filled with activists, and you have to forgive me if I need to get, and I hope NHF can find a way to guide us into preferred written communications you want us to issue to our congressmen and our senators. This is an agency heads of our government. If there's a way we can get recommended written insights of how to approach them, what to deliver them, to sway them, to take a serious look at who the hell we are and what our misgivings are about how our country's being managed now, I think it's an important help.
Yes. Yeah. So the first solution we have is there's an NHF page. Charlie, maybe you can put that right in the chat. And if you go to the bottom of the page, you can put in your zip code and you can send a letter directly to your legislators. Right. That's option one for the your citizens. Also for groups, there's opportunities to do individual letters on behalf of the NICE Act. And I also will be circulating a doctor's sign-on letter for physicians specifically with some really key citations. So it's really good right now. We're just getting started. So yeah.
Oh, this is great. This is great. Okay. I mean, I know it's there, but I want everyone to know it's there.
If I can add to that, Greg, Jack, that's what Greg and I have been doing for months, is speaking to the relevant staff on Capitol Hill, introducing them to our proposed bill language. And in that process, we've become a resource for those congressional offices that care about this issue. So one of them referred us to Congressman Gomert, who quickly realized Greg was probably the best source for her to figure out what legal language would work best for the bill they wanted to promote. And then we're friends now with folks on the Energy and Commerce Committee, which is the relevant committee in the House for this issue. We're now friends with the Pennsylvania Republican who wants to tackle the elephant in the room around vaccines, which is pharma's immunity from liability for vaccine injuries they got as a gift back in the 80s. So, you know, it's the same as for any issue. You got to have lobbyists and lawyers who can get the trust of the staffers that care about the issue. We need grassroots, so that's where the sample letter comes in that I posted in chat, and I'll do so again. That we hope folks will send to their representative and senators to support this issue. There I go. There's the link. Just put in your zip code and off the letter goes. And it has all the info. That's sort of artillery. You know, you need grassroots sending these grassroots letters so that once Greg and I track down the staffers that care to talk to us, they'll kind of have a clue what we're talking about. And the same thing is going on with some other folks on this call. Mary Bauer and Jenny DeMarco are my experts for 5G wireless risks, which has pretty much the same dynamic. It's an informed consent issue. There's corruption with the bureaucracies on the safety of these things. And, you know, that issue isn't getting as much traction now just because the COVID hysteria has gotten everyone focused on the vaccine risk. So we can actually make some headway on this decades-old problem. But the problems are in dynamic are similar. So that's my answer to that question, Jack.
That's excellent. I'd like to echo that. You know, I've seen Charlie work firsthand, and he is very good at what he does. And as a team, we become actually excellent because we are able to answer all questions that these legislators have. They ask very smart questions. Their offices ask very smart questions. And sometimes they need assistance. They need assistance with writing a bill. And if they go to legislative council, they get an answer maybe in 2 weeks, 3 weeks, not exactly the answer they were hoping for. But when they come to us, we've got 24-hour turnaround time with exactly the right answers. And so as a team, we're very effective here at NHF.
Yeah, not that we couldn't be even more effective with a few fat donations to allow us to hire some more, what'd you call it, Greg? The cavalry? Get some of those white shoe lobbyist firms in DC. Of course, they're all working for pharma right now. So getting them on our side is going to be a long-term pressure. But for what we do, Greg, yeah. And we've got the staffers that care about this issue who know who we are.
You know,
so
raising, go ahead, Charlie, sorry.
Yeah, good job, go ahead, Jack.
Yeah, raising the money is what I'm all about. And the advocacy, you know, what you and Glazer have done and what Dr. Benz is doing, these are all factors that put together a really fantastic puzzle for NHF to achieve the goals it has set this year as they have never been achieved before in history, okay? And we've just come out of the World Leader Summit, that one in the 92 countries. There was quite a response to that, but it's the first time. And I remember, I think I'm quoted in curriculum reading for communications, master's degree studies. Repetition builds familiarity, familiarity builds acceptance. Acceptance establishes that psychographic trigger that promotes an action, okay? Charlie, keeping everything up in front because of what you and Glazer is doing is so spectacular so that we, the advocates that are here, the 28 of us, or how many of us are here today, can actually take the steps immediately. This is over in what, 15, 20 minutes or something, okay? All I know is this, everyone should be on the NHF site and they should be banging campaigns and taking the action. And then let's set up an appointment with ourselves towards the middle of next week, and then let's do it again. And let's invite others to do it. And that's how it works. Thank you.
Lisa's been patient with her hand raised. And I just want to add that, you know, emailing is not enough. I actually was able to have a meeting last Wednesday with Senator Rubio's staff, and I asked very directly for Senator Rubio to introduce a companion bill to, you know, Louis Gohmert's bill. So, you know, we have to meet in person as well. So Lisa, you can unmute.
Yeah, thank you. My name's Lisa Kastner, and I'm an activist in the Los Angeles area. Met Scott and Carol when I was working on labeled GMOs, and I'm seeing the medical tyranny stuff going on. And the thing that I wanted to bring up is that as an activist on this in the past 3 months in the Los Angeles area, I've been reaching out to people who were in my organization. And there are a lot of organizations. This is a question about networking. All the people on this call I was so excited to see what's going on with this bill and what's going on with all the people on this call. And there are so many other organizations. What you have on your list does not even overlap all the stuff that all the organizations that I'm familiar with. No one is putting out the information that I know of about what you're working on. And it's very important for us to make a much larger coalition. And I'm not sure if you're familiar with all the organizations that are going, that I'm familiar with. And I want to know, with whom can I speak to share our, you know, our Rolodexes, as it used to be called, so that we can get those organizations on board to go against, you know, for certain bills and against other bills. There are so many groups that are working on these issues. I'm not sure who's working on political stuff at the federal level. This is the first. I mean, this is one of the bills that's going on at the federal level. I don't know if you're familiar with other bills. Is there a comprehensive person or organization that's attacking everything that we should all be signing on to so we can have a broad coalition? And that's the question.
Lisa, that would be NHF, which is an umbrella organization. So we have a campaign against the pending FDA new dietary ingredient guidance that's going to bankrupt supplement manufacturers. I mentioned earlier our experts on the call on the 5G wireless risk, which is similar in dynamic to vaccines. We're in contact with organizations that you probably have in mind about other issues and other bills that we're not even going to mention because we have a limited time, so we can't cover everything. Scott Tips, our president, is back from Codex, which, as too few folks know, always is attacking our treatments and trying to contaminate our land, water, flora, and fauna. What were some of the organizations you had in mind in terms of, are they working with us? Are they?
Sure. A Voice for Choice, PERC. I'm sure you have Children's Health Defense, Organic Consumers Association, maybe Institute for Responsible Technology. I'm not sure if they're on board. Dr. Mercola, The Truth About Vaccines, the National Vaccine Information Center, Health Ranger, hold on.
Well,
the Healthy American, Make Americans Free Again.
Well, let me stop you right there and give the floor to Greg, because he has been recruiting groups that you've mentioned. NVIC and CHD already are in our coalition for the Gohmert-Nice Act for the flat exemption from all vaccines and the cleanup vaccine science. Greg, what do you have to say about the coalition effort?
Yeah, the coalition is growing. We're just getting started, so now's a great time for your question, Lisa. What you can do is go to niceact.org, and you'll see there's a sign up. You can, if you share that website with any groups, and you can invite them to join as supporters of the bill. And all they have to do is just fill out the little form. So it's all set up and ready to go. So you can reach out to your contacts and make that happen. You'll also see at Nice Act a list of the supporters that are already supporting. So for example, Children's Health Defense is already on there. So you don't need to reach out to them. And so this is something we'll be doing basically throughout the year throughout 2021, so that by the time we launch next year in 2022 for the next session and what's coming, we think that's the time when this bill is going to really pick up the momentum. And by that time, this coalition will be massive.
That'd be super. So what you were suggesting to me is to contact organizations and ask them to sign on to supporting this using the website.
You can do that. Yes.
This is in some ways a peripheral question, but the concept of the tracing technology that's being proposed, at least at the California state level, is that something,
that's covered in the bill? Yeah,
the
bill prevents vaccine passports nationwide.
Do you have any traction with working with any Democrats?
That is in progress. That would be for Charlie.
That's a good question. I think anyone who's got experience lobbying state legislatures for vaccine choice, which is where this issue has been over the past decades, knows that Democrats have not been very helpful on vaccine choice. I can try to think of any, and I think of Representative Jolly, New Jersey Democrat. In my state of Virginia, Senator Peterson, I think he has a vaccine injured kid. He voted for us in committee, then voted against us on the floor. That's up for anyone. If you can figure a talking point communication strategy to get Democrats to realize that pharma is not exempt from the rule that special interests corrupt their bureaucracies, that would help us, because there's the whistleblower William Thompson, that the MMR causes autism, especially with Black boys. We've tried it all to get them to please let there be informed consent with vaccines, and we still want to do that. We have an open mind. We come honestly from our positions, and if you have any ideas, Lisa, you would be a hero, because that is something that a lot of us have tried to do over the years. We have celebrity Democrats. Robert F. Kennedy is a Democrat, although folks don't understand that sometimes. What's her name? Naomi Wolf. There's more and more of them, especially now from the COVID hysteria. There's more Democrats, Bill Maher, that are, hopefully that celebrity coming on board will trickle down to legislatures. So yeah, we're looking for a Democrat.
So so let me just ask one last question. Who would my contact in NHF be if I wanted to further discuss this? Then I'll release the floor. You, can I get your contact information, Charlie?
Sure, I'll just put my Yahoo address. That's the easiest for now.
Okay, thank you.
Email me, anyone.
Mine, Lisa, I've added mine. I'd like to speak.
Oh, thank you, Jack. Okay,
Jack,
all right. Okay, great. That sounds
very
super
important.
Okay, happy to help.
And I do urge folks to join Dr. Ben's Health Upgrade Project for our next meeting, December 10th. We shouldn't just put out fires. We have to, of course. It's but let's go on offense. Healthcare was a cartel before the COVID hysteria. There's not enough integrated medicine and health benefit plans. The bureaucracies are just bought and paid for tools of special interest. Of course, that's in every industry. The education system for medicine is very narrow and limited. You can go down the line, and we're going to tackle all these issues, and we need people on deck willing to join our breakouts.
I really appreciate it. Thank you.
Alex, maybe you can help me mute these people talking. And so don't forget that project. So we had the vaccine choice bill, the 5G wireless bill. At that campaign's link are all our campaigns. We can't update each of them each month because some are more important than others. But
Charlie, can I make a comment on that?
Yeah, go ahead, Dr. Benz.
We really would like to get around 40 or 50 people at the next meeting on the 10th, I think it is, because we're going to go into these small groups. We're probably going to have about 7 or 8 different categories to be covered in terms of using the effort and impact analysis. And so if we could have a larger group, then we can really be effective in breaking down each of these solutions that are brought to us and using the effort and impact grid and finding out which ones really fall in that favorable range of low effort and high impact. So if we have a limited number of people, then we're going to have a limited number of opportunities to really do a proper analysis. But we need those subgroups to be able to accomplish that. So if we can urge people to get out on that meeting date and spend that time, which is going to be about a half an hour in the small groups, that would be so much appreciated.
Indeed. Who else, Alex, has their hand up? We're going to want to unmute themselves and ask a question.
Yep. I think it's Sheila.
Yes, good morning. I'm Sheila Hemphill with Texas Right to Know, and I have been working with integrative physicians and researchers since 2008. I am a registered lobbyist in Texas because if you spend a certain amount of time at the Capitol, part of ethics that you have to register. Does the NHF have talking points for constituents to be able to put the elected officials running for Congress every 2 years? We're in that sweet spot of when they're going out and having their town hall meetings. And we need to prepare, if it's not already done, what the constituents need to be asking their congressman to put them on the record, because we have between now and March.
Yeah, I'll answer that. The sample letter has our best pitch for why we want exemption from all mandates. So that is the link to use. Just to keep it simple, and as Jack said, to encourage repetition, we're going to just use that always and every time.
But is it like, for instance, I've been all over these coronavirus state and local fiscal recovery funds that are coming out through the American Rescue Plan. These funds require the recipients to go into contract with the U.S. Treasurer, where the terms of compliance include executive orders, not just federal statutes and regulations, which contracts have always had, but now they include executive orders. And billions of dollars are going out, and we tried to stop it in Texas because it was allocated. The funds are allocated by state legislatures of who gets it and how much, or at least it was in Texas. But then the recipients go into contract with the U.S. Treasury, which includes executive orders, which can come with the stroke of a pen. We've seen that happen. So this is happening all over the nation. And I did a national press release on it October 27th, as we tried to mount a veto of $16.3 billion. We know that Governor Abbott received the information because when he signed the bill 10 days prior to when it was due, he referenced the Attorney General stating that it was that receipt of these funds would not likely lead to a legal COVID-19 mandate. And that with that, he signed it. None of them address the fact that this is stroke of the pen compliance, which, by the way, has a cascading effect that is not just the recipient, but it's the recipient must provide compliance with any other party in any agreement related to the award. So we have reason to believe that this could be a cascade effect that would go to not only the cities, say, let's say it's the city that had the award for a utility service like water. It would not only apply to the city and their employees to be compliant if Biden issued a vaccine mandate, but it would also be to the subrecipients for contractors who would be building the water project. And then the question is, if utility customers receive the benefits of that award, would you have to be vaccinated to comply so that the city stays compliant? It's a mess. And I've been very focused on it. In fact, I got the Texas Municipal League, which is the lobby group for municipalities, to back off of their inerrant statement that they just removed. That was yesterday. So that's kind of my focus, and trying to equip people with action items to go call your congressman. Here's how you look them up. And I'm sure y'all have all that. But my website is texasrighttoknow.com.
Sheila, if you're going to put that in the chat to everyone.
It is.
Okay, great. Greg, I'll let you respond, but as good as our bill and the campaign is, we're not going to address every aspect of this COVID tyranny. And as you know, Sheila, every day we learn new terrifying aspects of this through funding, through backdoor ways, to indirect ways. So email me definitely more about that. And Greg, do you want to respond?
Sure. Yeah, I've studied the history of executive orders to see their applicability in terms of how far they can reach into states' rights. And what you find is that scholars tend to be deferential to executive orders, even though their foundational jurisdiction, their reach is supposed to be limited to departments of the executive. But when these public-private partnership contracts come together and they will insert compliance with executive orders, what you have is, and you've correctly identified, Sheila, it's a workaround. They're trying to get around this, this jurisdictional limitation. And are they allowed to do it? That is something.
Well, here's what really concerned me,
Yeah.
Greg, is when I talked to an attorney who is a founder of a constitutional, he said, Sheila, here's the thing, an executive order issued as a dictate, like we're seeing right now. In Texas, we're all in the same boat and we're under the protection of our attorney general, who is filing and pushing back with lawsuits because it's to all Texans. When you sign that contract, you have agreed by consent to comply with executive orders, and the relationship is between the city or the county directly with U.S. Treasury. The state has no standing. The state has no capacity to come and defend you. You're going to be on your own. And according to the U.S. Constitution, Article 1, Section 10, no state shall pass any law impairing the obligation of contract. So what they're not been able to do through law, they're doing it through administrative contract. And also the CDC, for the providers that were issuing the vaccine, administering the vaccines, by contract, they were required to record every recipient into a national database. I don't know if it's national or state database. Now, how much of that was in the informed consent? So it's by contract that they're getting us. I'm very concerned by contract.
I've been seeing that for 20 years. It's they did it with the entire emergency health management system from in every single state. And I even sat in on one of the meetings. And what you find is that the federal government and state governments make contracts, these emergency contracts, where they plan ahead for emergencies. And for them, it's emergency preparedness planning. I think they're doing great. But the reality is that it creates this hierarchical structure where top-down orders come and everybody complies, all the way down to local hospitals. They just agree to follow the plan, including use of things from the national stockpile, which is vaccines. So it's a systemic issue.
Well, and what we're trying to mount a push against, and I have the ear of very good senators in particular. They believe me, but the problem is they know that their chamber of 31 in Texas don't have a clue, and their constituents don't have a clue, because all they hear is propaganda from mainstream. But I probably have about 7 or 8. Before this issue came up about the contracts, which was October 5th, that it came to my attention. In Texas, 70 communities are turning back the money, saying we're not taking it. Before that, I had picked up Dr. David Martin's interview with Reiner Fulmick, and I transcribed that July 11th interview that was very much like a deposition. And black bolded was significant, red bolded shocking, and red bolded underline was alarming. That was 20 pages, along with Dr. Martin's 30-page Fauci COVID-19 dossier. I condensed it. I did an executive order, 77 pages, printed and delivered to every House of Representative, every senator's office, governor, lieutenant governor, attorney general, medical board, all received copy of what was entitled the Omega Brief. That document is now getting delivered by constituents to their county commissioners, city councils, and school boards. And the reason being what Lisa was saying, I even saw benefit of this working in Democrat offices. because when you turn the page and the first bolded, underlined, alarming statement is "we made SARS and we patented it on April 19, 2002, 95% of the time I got, wow, oh, even, and so my statement is we've all been injured from this deception, but you can't argue with who owned the patent and when they owned it. Medical and science is ripe for debate. We're
Was that
not going to stop
SARS-CoV-1?
this. Huh?
Is that SARS-CoV-1?
Exactly. So it was transcribing the video of it, was highly beneficial. In fact, last night, a woman said, now this is in the middle of central Texas. She said a lady that has 20 home healthcare agencies stated how so many of their employees are not going to be getting the vaccine because they've all been reading the Omega brief. I went, yes, because it's action items that people can take at their local level and deliver it. So it's kind of a pseudo, you've been served. And
I'm always
at the
impressed
Capitol,
by how many different approaches there are and how they all sort of work together in the end for good.
well,
And I think that, you know, different things will different aspects of the research will awaken knowledge within different folks, including in the legislature. So, you know, I appreciate all the different approaches, and I know David Martin is really taking that strong leading position. So.
Well, the Omega brief is there for download. And it can apply to any state. My theory is, with Texas being such a big state, if we can get penetration and causing this to fall with everybody reading the same irrefutable information. Medicine and science is chaotic. Everybody has an opinion. Everything, you know, you can't win, I don't think, on medicine and science as clear as it is. The patents, you can't argue with it.
Well, thanks,
Well,
Sheila.
I'm not
We have
gonna
your
argue
link.
with it.
Go ahead, Greg.
Oh, wait, Craig, I would love for you to see my email I'm doing to the General Counsel of the Texas Municipal League, which is the publicly funded lobbyist for all the cities of the state of Texas, that I got them square in my sights of error, that they said that these contracts would not have any contractual arrangement between a city and the U.S. departments, federal governments. I'm like, wrong. Anyway, yeah, stay tuned. Thank you for allowing me to speak.
Definitely, Sheila. Thank you, Greg,
Thank
for
you.
the comments. There are many paths to this crisis we're in, and that certainly is interesting information. And with David Martin involved, I'm sure we'll have to revisit it. So thank you, Sheila. Alex, anyone else have a hand up?
I don't think so. Nope.
Anyone else want to unmute and say a last word or ask a question?
I just want to unmute to say I have another meeting at 10:30 on Zoom, so I have to go so I can sign on to the other one, and just thank everybody for all the work they're doing. And I'm so glad Lisa brought up that we just all have to work together and we'll win.
And how can we reach
That's
AAPS,
right,
Dr. Singleton?
Thank you.
aapsonline.org.
Wonderful. Thanks, Dr. Singleton. We'll see you soon.
Okay.
Alex, anything else?
I guess I could share real quick Jennifer's event. So anybody in Texas, please come by the Fall Freedom Fest. I will be there manning the National Health Federation booth, and look forward to connecting with as many people as possible, as many health freedom activists as possible. So the Fall
I hope
Freedom
you have a
Fest.
cowboy hat.
Yeah, I
Alex,
might have to grab one.
where is New Caney? Where's
It's outside Houston, so it's like 20
Oh.
minutes from the Bush Airport there. So I'll be flying in tomorrow evening and then flying out Sunday evening after the event.
And Nurse Bridges, the organizer, has participated on our monthly Zoom. She's the nurse who got fired from Houston Baptist and sued based on that, and really got nurses organized to push back. Isn't that right, Alex?
Correct. Yeah, Houston Methodist. They're trying to get to the Supreme Court, and yeah, hopefully address the whole issue with like Medicare, Medicaid, and the mandate for hospitals.
So December 10th is our next brainstorm on the health upgrade project with Dr. Benz, always Friday at noon Eastern. And the following Friday, the 17th, is our next regular meeting where we'll update on our various projects, vaccine choice, rate of frequency mitigation, supplement access, codex, etc. So thanks all.
Lisa, do you have another question, or Sheila too?
I'm trying to grab the chat and I'm trying to see if I put my contact information to everyone. Yeah, I did. And I want to grab the chat. Greg, how do I get in touch with you? Because I'm interested about your executive order research. And anybody else. And I put I take calls from 9 o'clock in the morning till 10 o'clock p.m. Central Standard Time.
Anyone can email me, cfro@yahoo.com, and I'll hook you up with whatever you want.
Oh, perfect.
Okay.
Thanks.
Okay.
Lisa?
Now, what do I do to get all the chat? How do I get all the chat?
You go to the three dots next to where you can enter. Press on the three dots, and then it'll say more, and then you get a choice of save chat.
Okay, I have the chat open. I see three dots as if I have save chat. There we go. Okay.
Yeah, I wanted to know from I think it was Greg, how long this bill, the NICE Act, will stay in play. How long do we have to get it passed in this session?
Want me to take that, Greg?
Yeah.
Congressional bills in DC last through the session, which always lasts until the next election. So it's even years. So November 22, 2022 is when the bills die. So we have until then, and because of Democrat control, don't expect anything with this bill or any good bill until the next year's fall elections. And then come January 23, a lot of us hope, given the trend started in New Jersey and Virginia, with Republicans retaking control, that we'll have a real chance to fight back on health freedom. Unless, of course, we get a rhino dynamic where a lot of them just start looking at that pharma money and going, we're not so enthusiastic anymore to help you. So even with Republican control, don't think we're going to be out of the fire. So that's the timeline.
But based on what you're saying, that in this particular session of Congress up through November, the bill will die in November, except the whole time the Democrats are in control of the Congress. So we're building support for a bill that has no hope of passing. Is that what I'm hearing?
Yes, and people do that, and you have to do that, because if you wait for a better Congress to come around in 23, what have you done until then? Have you really not pushed a bill to get education, coalition? You have to start the coalition when things are against you. So not to push a bill now is foolish.
So the people that it's affecting, people who are going to take shots now, saying that they don't have to take shots. So it's sort of, I mean, the pressure is on people now to take the shots.
And that's where lawsuits come in.
Yeah, and always remember, it's public pressure that influences our public policy. So like nothing's stopping a bunch of us from getting very organized and doing critical action and actually, having the public pressure needed to.
What are you finding? Yeah, what are you finding is the best public pressure? I'm a very blue area.
We have to be very organized. That's all. We have to organize better than those who love war, those of us who love peace. So we just have to be very organized and very focused. And, when you talk about a coalition, it's like we need so many people on board with just striking this one paragraph of law away, the liability shield. And then from there, thanks to David Martin, we know that Big Pharma's already planned this. The nonprofit's called Answer. They're the contractor for Operation Warp Speed, not Pfizer or Moderna. It's all a shell, for basically, becoming bankrupt as we become more intelligent and remove the liability shield that should have already been removed by now. But I guess it's taken this, type of dire situation to motivate us to make it our priority and our purpose.
Thank you. Right.
Yeah, thank you.
We are using resolutions.
Yeah.
We're using resolutions that are cut and paste to direct people to submit it to their county commissioners, submit it to their city council, and then ask them to take that and send it to their state representative and state senators. So we got to go local, because that's where the, and right now is the sweet spot between now and March. Are all primaries in March in all states? It is in Texas. We have the primary, and that's really the only time you can get these people, is every 2 years when they're trying to get that one position as the representative for that one party. After that, it shifts into the battle between parties. But right now, between now and March, the constituents going to these town hall meetings need to be able to hold their feet to the fire. Are you familiar with the NICE Act? Will you support it? Why won't you support it? How can you be against blah, 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 whatever the talking points are? But we got to empower the people to give them action items that they can do. And resolutions are pretty good. And I've got a tab on my website for resolutions that I'm just starting. And there's several. And we get a ripple effect. If we can get one county starting to do it, it starts popping up around.
Okay, well, you and I've got to talk, because I'm in an area where they're already instituting vaccine passports in my county, my city. They're not accepting public meetings of the city or the county. It's all the city of Los Angeles. It's all remote still. They won't let the people show up. They give you 1 minute to talk, and then you have the sense that they don't even listen to what you said. There were tons of responses, but our county health person gave your standard explanations of whatever the narrative was. Our governor's eager to pass all kinds of laws, and you have a leg up on us, shall we say, because educating people who've already passed things and are already on board with the narrative is a big challenge. And the focus here in the Los Angeles area seems to be come to protests and get other people educated. But it feels like there's got to be something more that we can do, because they tabled a bill in the state Senate that was going on in September. They had two bills. One was that they tabled both of them. One was, you don't have a right to work or apply for a job in California if you don't have the shot. And the other one was that we're gonna track everybody in the state. And so those ones are coming up for us, probably, hopefully they'll wait until January, but we have a lot of people who are very upset. And right now we're sort of chasing after, we're on the defense. There's tons of moms who are aware of this, or at least I hope there's tons of them, because they've now saying that all the kids have to be vaccinated from age 5 up and up. That we're sort of running defense constantly.
Okay, Lisa.
Yeah.
When do your candidates are able to get on a ballot? When's your primary?
I think our primary is in, I think it's in June.
Okay.
Yeah, every state's primary is sometime in the spring or summer.
Somebody on a ballot.
There's somebody. I mean, I know there's somebody who wants to be governor, who's applying to be governor in this state, who's anti-mandates. But is that what you're referring to as a governor, or what?
I call it the dog catcher rebellion, because in Texas we have till December to put somebody on a ballot to run against that primary, that party seat. We have till December to put them on the ballot for the election in March. And so basically I'm advising people to say, look, if you can't get your congressman to agree that you have the right of liberty to your body autonomy, then I call it the dog catcher rebellion. We'll put the dog catcher on the ballot. and we may not win. We just need enough to make sure you don't. Okay. So that's a lot easier than trying to do a win. And you go toe to toe with them and put somebody on that ballot. Just, you saw the truck driver, right? Go, the truck driver? Where was that? In Virginia? Where did the truck driver
New Jersey.
win? New Jersey, wasn't it?
Yep.
Okay, let's call it the truck driver rebellion. I'd rather have a dog catcher that would protect me from a rabid animal that's a do nothing, that's spineless, that sits there and has power and does nothing and won't even speak the truth. I'd rather have a dog catcher. My husband goes, that's an insult to a dog catcher. But so it could be truck driver. I mean, you gotta hit them. You don't even have to win. They go, well, you can't win. I said, I don't need to win. I just need to beat you.
You don't have a two-party system in Texas?
I don't know. That's what we do.
Mm-hmm. And Lisa, I'm sure you're already
Mhm.
connected, but whoever like the top health freedom activist is in your community, in your area, really linking up and brainstorming solutions.
Well,
Yeah,
that'd be Children's Health Defense would be in California.
Yeah, no, I've connected with them, but they're focusing right now on lawsuits and trying to organize groups. I was at a group meeting last night, but there's not enough focus. In my mind, there's not enough focus on action except for attending rallies, and rallies aren't legislation. I know that we have a problem in legislation, and I know they have a problem in lawsuits. I mean, they're trying to support all these people because LA Unified School District is huge, and they're suing they've got a lawsuit going on behalf of firefighters and police officers, and they've got another one on behalf of parents about the children, and there's another one about fighting LA Unified. I mean, they've got their hands full, and so I actually would love to know there was another organization that I could connect up with in my area. If you know of anybody else who's really well organized to focus on legislation. I do not want to start the organization. I know I could, but I know that's a long, huge effort. This is LA itself. The city of Los Angeles has got 4 million people. We've got a lot of reps. We've got a lot of levels of government going on. And I love to connect with somebody who's already doing this work because I can contribute.
Lisa, every state has a fill in the blank for medical freedom. Virginia has Virginia's for medical freedom. Virginia Freedom Keepers. Every state has groups with the similar phrases. And those folks have been going to the state legislature for years, especially in California, my goodness.
Mhm.
So
Right.
if you Google those groups, you'll find who's active and they'll give you ideas.
Okay, I'll check into it. Thank you, everybody, for your ideas. I have to give some thought to this and see what's going to be next.
And we've run way
Yeah.
over time, Alex, but I think we do have to
Yeah.
say goodbye.
But we share your concern, Lisa, with what's happening. And you got to always sometimes, remember you have the power to move, too, and to not necessarily be in a tyrannical local government environment.
Thank you. I think that Sheila and I saw you wanted to talk. Sheila and I, maybe we should talk separately. Would that be best?
You know what? Here, let me pop in my Zoom, my personal Zoom ID, and then that way, well, you can just email me. I put my email on my phone number.
Your information
Wait,
was
no,
in
I
there
don't know
already.
that I did much.
I saw your information.
Perfect.
You posted it in the chat already.
All right, everybody. So we
Okay,
know
thank you for running over on my behalf. I appreciate it.
December 10th and then December 17th. Hope to see all of you there. Thank you, everybody. Thank you.
Thank you.
Carl.
Thank
And
you.
That's all.
Bye.
These are every Friday.
Every third Friday, we
every
do the
Friday?
monthly
These are
Zoom
every Friday?
legislative update, and then we've been
Okay.
doing the Dr. Ben's meetings as well. So stay tuned. Make sure you sign up for our newsletter, so you can get all these updates and alerts and the invites for the Zooms.